The reality is, if you don't take it seriously, diabetes can wreak havoc on your body. When it comes to sugar, especially white sugar, there are so many alternatives out there, natural or prophetic remedies out there that can help you to either get off of these medications or at least reduce those medications. Assalamu alaikum, peace be unto you. Today, brothers and sisters, we're going to be discussing one of the most common medical conditions out there. And unfortunately, it's one of those conditions that's one of the most rapidly spreading conditions. We are talking about diabetes. I'm sure all of you know somebody who has diabetes, either yourselves or family members or friends. So again, diabetes is so common right now that about 12% of the population in the US has diabetes. Globally, around 11% of the population has it. But like I said, unfortunately, those numbers are growing even more rapidly as we go by. Diabetes is one of those conditions that people, when they're diagnosed with it, they often sometimes take it lightly because they know that they can take certain medications for it that can help. But the reality is, if you don't take it seriously, diabetes can wreak havoc on your body. We know that diabetes significantly increases your risk for both heart attacks as well as stroke, cardiovascular disease. We know it increases risk for kidney problems, even neurological problems, even eye problems, even circulatory problems, and that's why some people unfortunately get their foot or leg amputated. I've actually seen cases of this. So again, brothers and sisters, we should take it seriously. It's not something to be played with. I've even seen patients who were diagnosed with diabetes, and within the span of a few months, their blood sugar shot up so high that they went close to being blind. So again, this isn't to scare you or anything, but it is something that we need to take seriously. In order to understand, brothers and sisters, some of the best natural and prophetic remedies out there for diabetes, we first have to have a better idea of what's actually causing it. So let's first talk about the causes for type 2 diabetes, which is the most common form out there. You might know type 1 diabetes is quite different in that condition, there's not enough insulin production. It's more of an autoimmune attack against the insulin, so it's kind of a different ballgame. But when it comes to type 2 diabetes, keep in mind an overriding cause or an overriding factor is what is known as insulin resistance. If you don't know what insulin resistance is, it's basically an inefficiency in the insulin where, due to years or decades of getting exposed to various variables, your insulin becomes less effective over time, and so it's not able to do a good job of getting or extracting the glucose out of the blood and into the tissue. So when that happens, the blood sugar starts to rise. So to give you a very simple analogy of this, brothers and sisters, think about a very hot day where the temperature is maybe 110 degrees. If you have a beautiful brand new AC energy efficient unit, it'll bring that temperature down to around 72 degrees, no problem, right? If you have, on the other hand, a very old inefficient AC unit, you put in that set point of 72 degrees and it doesn't bring it down. It's trying, it's maxing out, and it's still not able to bring that blood sugar down. So insulin resistance is kind of like that old inefficient AC where it's been working for decades, it's gotten older now, and it's not able to get its job done properly. The point I wanted to mention, though, brothers and sisters, is there are so many variables that lead to the insulin resistance in the first place. So let's go over probably the top 7 reasons for that. The first cause that I wanted to mention relates, of course, to one of the more obvious ones, which is diet, and more specifically high intake of not just sugars, but high intake of highly refined, highly processed, simple carbohydrates. We typically talk about what's known as the 4 whites, right? The 4 white good stuff, all right? White sugar, white flour, white rice, white pasta. Again, excessive amounts of this over the course of years and decades can lead to way too much insulin production and insulin resistance, as I mentioned earlier. A second related cause is when you get obese or overweight in general, whether it's due to insulin resistance or not. Just the fact of being obese or overweight almost by definition leads to some level of insulin resistance. Number 3, there are frequently nutritional deficiencies that are involved in poor sugar metabolism. The most common ones are low levels of vitamin D, low levels of certain minerals like zinc, magnesium, chromium, vanadium. That's why you'll see a number of different supplements out there that combine some of these minerals. If you look at other nutritional deficiencies, we often see a lack of sufficient fiber in the diet. We often see a high intake of the highly refined seed oils, like too much soy oil or corn oil or sunflower oil, and this in turn leads to a high ratio of what we call omega-6 fatty acids to omega-3 fatty acids, and this can be yet another trigger. A fourth reason, brothers and sisters, for cause of diabetes relates to insufficient exercise. There's a ton of research out there that exercise helps to actually treat insulin resistance and do a better job of getting your insulin to be more efficient. And so exercise or lack thereof is another frequent cause. A fifth cause, which is also very frequent but often neglected, is high stress, especially over the course of months and years. We often see in patients they'll have a perfect storm of having either too much stress along with poor diet or nutritional deficiencies that all coincide and can often lead to such issues. A sixth cause that people don't really talk about much but is known now relates to something called dysbiosis, which is an imbalance in the gut flora, an imbalance in the microorganisms of your gut. There's a ton of research over the last few decades that about 70 to 80% of the human immune system is in the gut. So gut health affects your overall health, including sugar metabolism. A seventh cause that I wanted to point out relates to genetic or hereditary factors. There's a lot of research that insulin resistance can run in families. It doesn't mean that you can't do anything about it, but it is something we should be aware of. So again, now that we have a better idea of some of the causes, let's go over treatment. There are obviously so many different drugs out there that people are relying on, and they play a very important role. I'm not against drugs. The most common drugs out there for diabetes are metformin. There are what's known as sulfonylurea-based drugs. There's something called glyburide, glipizide, different brand names like Januvia, Jardiance. You may have seen some of their ads. The most popular recent drugs I'm sure all of you have heard about relate to what is known as the GLP-1 inhibitors like Ozempic and Mounjaro injections and so forth. The ones who have more serious diabetes or even type 1 diabetes end up taking insulin injections. So all of these drugs are out there and they do play a beneficial role. I'm not docking them at all. They are necessary in certain cases. But at the same time, most people are not aware of some of the natural or prophetic remedies out there that can help you to either get off of these medications or at least reduce those medications. You know, I have even patients who do both natural as well as conventional medicine in parallel. So there are always options out there. And again, as we go over some of these treatments, do consult with your doctor before proceeding with them, because if you take too much of them, sometimes your blood sugar can go too low. If you don't take enough, sometimes the sugar can remain too high. So every individual is unique in terms of dosing and specific amounts of specific remedies. So keep that in mind. All right, brothers and sisters, next we're going to be offering certain techniques, again, from both a prophetic perspective as well as certain natural tips on what you can do to better control your blood sugar, whether you've been diagnosed with type 2 diabetes or even pre-diabetes. All of these suggestions will be helpful. These first 5 tips that I'm going to offer are all based on prophetic medicine. So subhanAllah, listen and hopefully they'll be helpful for you. Number 1, we have whole other videos just describing the importance of moderation and proper diet. We already spoke about how the 4 whites can be major triggers for diabetes and blood sugar issues. We talked about white rice, white bread, white sugar, white pasta, and so forth, which again relate to the highly refined or processed grains. So again, these have to be minimized. If you can avoid them altogether, your results will be even better. Again, these are basically you want to substitute them out with what's known as low glycemic foods, and you want to avoid or minimize high glycemic foods. There's what's known as the glycemic index, which is a number between 0 and 100, where glucose is around 100. Things like white sugar probably around a 70 to 80. Some of you may be surprised to know that the glycemic index for white flour is around 75 or 80, which can be higher than even white sugar, believe it or not. So again, you want to minimize those type of foods. For some reason, especially in the Desi population, they think that wheat flour is better than rice, and so they tend to do a lot of bread. That is a misconception. They're all still grains. Whether you do white rice or brown rice or white flour versus wheat flour, there's still carbohydrates. You know, the forms that have more fiber are obviously going to be a little bit better for you, but keep in mind, they are still carbohydrates. So again, you want to switch some of those out with healthier alternatives. When it comes to grains, consider switching them out to barley. Barley is one of the things that was used in the time of the Prophet ﷺ, has a glycemic index of only around 25. Some people out there will use, like I said, brown rice or quinoa or millet or oats. Again, these are grains and they're carbohydrates, but at least they don't bring on as high an insulin response as some of the other grains. When it comes to sugar, especially white sugar, there are so many alternatives out there. One of the best kept secrets out there that's natural is known as stevia, as well as monk fruit sugar. Monk fruit sugar and stevia have a glycemic index of a whopping 0. That means they have hardly any effect on insulin and hardly raise your blood sugar. So they're like little miracles out there in nature that people can make use of. Other things that are natural that people can use as alternatives: honey. We all know that honey is mentioned in the Quran, and I have a whole other video on honey. The glycemic index of honey varies depending on the type, but is generally around 50 to 60, so it is going to raise blood sugar, but not as much as some sweeteners, and at least honey has certain benefits. Some people are using sugar alcohols. They have relatively much lower effect on your insulin and blood sugar, but they do have the problem that they're still processed and they have negative effects on your gut health. So that includes things that you'll see on labels like erythritol or maltitol or sorbitol or xylitol. So again, this is one tip right off the bat. A second tip I wanted to offer from Prophetic Medicine relates to fasting. Again, for decades, people have been advised that they should take small, frequent meals throughout the day, especially for diabetics, to try to maintain a blood sugar. But in practice, we're seeing that most people are not able to control their diet that closely or eat super healthy foods when they do so. And so there are other studies in the last several years that have looked at the value of fasting or intermittent fasting with respect to blood sugar, and they're seeing that actually much better results with fasting. Again, if you try fasting with diabetes, you really do need to consult with a qualified practitioner before doing so, because again, you don't want to pass out or go unconscious from too low a blood sugar. There is a very important reference from a study done in Newcastle, UK, called the Newcastle Study, which was done in 2022, which was really amazing in this regard. They took full-blown diabetics and they put them on a medically supervised diet of, I believe, around 800 calories or less per day. But again, it was medically supervised, but they found that within 2 or 3 months of doing this study, that there were actually some cases of remission of diabetes altogether. And even the ones that didn't get remission found a significant improvement in making their insulin more effective, better blood sugar values, better cholesterol, better triglyceride numbers, better blood pressure, and so forth. So again, I'll attach the reference below. A third tip that I wanted to offer from Prophetic Medicine that relates to blood sugar relates to individual herbs and foods that are beneficial. There are literally tons of different studies on this particular subject. Again, I'll attach them below, but black seed, and especially the oil of black seed, is very beneficial. Olive oil, which is mentioned in the Quran itself as well as in Hadith, is also very beneficial for blood sugar. Vinegar is one of the Sunnah foods. Again, I have videos on all of these different super Sunnah foods, but there are tons of studies out there on their benefits. Another Sunnah food that's beneficial is known as fenugreek, or what is known as helba in Arabic. So again, because everybody's in a different situation, and especially their blood sugar situations vary, if you do utilize these remedies, again, it's better if you consult with a qualified practitioner who has experience in prescribing these natural remedies. Another fourth tip from Prophetic Medicine relates to hijama. We have spoken about hijama in some of the other videos as well. People don't normally think of it as being something that's beneficial for diabetes, but there are actually published studies done even in Muslim countries. There are recent studies that have been done in the last few years in Malaysia as well as in Kuwait that have shown that hijama can be beneficial even for lowering blood sugar. So again, go to a qualified practitioner if you do so. A fifth technique from the Sunnah again is exercise. Again, it may sound obvious, but exercise is part of the Sunnah as well. And there are tons of studies, if not in the thousands, that show that exercise improves what's known as insulin sensitivity and decreases insulin resistance, meaning it makes it more effective. Government guidelines with respect to exercise show that common person should be doing about 2.5 hours per week of what we call moderate intensity exercise. And the government, at least in the US, recommends 1.5 hours per week of what's known as vigorous intensity exercise. They also recommend some strength training at least 2 days a week. So again, we have to evaluate ourselves and see where we're at with respect to exercise. A sixth recommendation that I'll offer, which is not necessarily directly from the Sunnah, but these are naturally proven medications out there, the most famous of which is probably known as gymnema. It's an Indian herb. In Sanskrit or Hindi, it's called gurdmar. And this gurdmar or gymnema has been studied in medical journals to be as effective as metformin. So it's something that's kind of like a hidden gem out there. Other natural remedies that are useful for diabetes are berberine, cinnamon, alpha-lipoic acid, bitter melon. Again, these are very effective herbs and supplements, but they should be prescribed by a qualified practitioner. Nutritional supplementation that you should consider includes supplementing vitamin D, magnesium, chromium, sometimes vanadium, omega-3 supplements. These are often supplements that are quite safe to take with medications and can help improve the control even more so. But again, if you're not experienced with them, it's better to consult with somebody qualified. Last but not least, an eighth tip that I wanted to offer relates to stress management. Again, it's something that's neglected out there, but high stress over long time periods can raise your blood sugar, even independent of diet. So you want to consider certain natural techniques for lowering your stress levels. Obviously, in Islam, we have so many different types of prayers and du'as, so these should not be underestimated. They should be fully utilized. There are techniques involving relaxation, exercise, prayer, meditation, all of which can help with stress management. If you still need help, there are additional herbs out there known as adaptogens that can also help reduce your cortisol and help in regulating blood sugar. The most famous of which are ashwagandha, holy basil, rhodiola, Siberian ginseng, and so forth. So again, these are some fantastic natural remedies that are out there. Again, consult with your doctor before using any of them, but do try them out, listeners, and let us know in the comments section how it goes. We wish you all success in controlling your blood sugar and living happier, healthier lives. سبحانك اللهم وبحمدك نشهد أن لا إله إلا أنت نستغفرك ونتوب إليك.